because the virus can last so long on surfaces, and because we're in a moment where community spread is the issue, we really have to practice social distancing. And this is something that has worked in China with their number of infected population going down dramatically and then returning back to social interactive life, and is what has been imposed in Italy. We're defining that by being in a space where you have at least 6 feet of distance between the people around you. This is why so many community events have been canceled, because the crowding really increases the risk for this virus to be transmitted. So in talking about the mortality of this, it's important to note that there is this exponential increase starting at the age of 60 and moving up. So our highest risk populations are anyone with chronic disease, regardless of age, and then 60 and above.
Dr. Khoury,
Yes.
my kids have been asking me questions about their own safety in this process. They understand that it tends to affect people who are older, and so they've been a little cavalier about the idea that they can't get sick, and if they did, it wouldn't be as severe. So can you talk a little bit about generational divide?
That's a really great observation from your kids. So thank you for allowing me to address that. So indeed, we are not seeing a mortality rate lower than the age of 10. But again, that's data, and that doesn't necessarily mean everyone's individual experiences will fall in line nicely with the data. So that's the first thing to kind of keep in mind when we're looking at population information, population level information. There are some truths when and if you were to get infected with this virus, it's impossible to know how it will affect you. If it attacks the upper respiratory system, your symptoms could look very much like the common cold. However, if it attacks the lower respiratory system, and then we're talking about the lungs, symptoms will actually mimic pneumonia. And that's where you hear so much about fever, shortness of breath, and cough. When people are talking about this in general, like, is this the flu? Is it pneumonia? Well, in essence, this virus can mimic both. So it's really important to stay in tune with your own symptoms.
And as I understand it too, one of the things I tried to remind my own kids was that they can be carriers of it, maybe not feel sick or super sick, and be able to transmit it without knowing. And that's one of the reasons why we're being so cautious right now, why they're not going to school, why we're not having meetings.
Yes, and that's why the social distancing is so important. Because again, you don't know how it's going to affect you or the severity with which you could have it. And you don't know necessarily how you can affect the people in your community.
Aysha, given the way the symptoms present, they can be really common. So
Yes.
I know, especially here, it's been raining a lot, and sometimes people will wake up with a sore throat. They won't feel particularly well. When should we worry? When should we start thinking that these symptoms are something more than just allergies or environmental?
So we know a little bit more about COVID-19. About 10% of people will have GI symptoms, so nausea, vomiting, diarrhea, even before they have fever. So in terms of the upper respiratory symptoms that can present like the common cold, we just need to be conscientious in terms of our hand hygiene and social distancing. And that said, we're also coming into allergy season.
Yeah.
So everyone can be having some sort of respiratory symptom. And again, there, you have to, again, be very in tune with your body. Are you having, itchy eyes and itchy throat, itchy ears? Well, again, if you have a runny nose in that context, most likely allergy, okay? But if you're having fevers or you're having shortness of breath, then we need to think about coronavirus, okay? And then if you have the GI symptoms, the fever, shortness of breath, that's when we need to think about, okay, this might be something serious. In that regard, this is when social distancing also plays a role in not overburdening our healthcare system.
Right.
We have excellent medical communities that are working through this, but we're also dealing with finite resources.
Yeah.
And so that said, if you're having symptoms of the common cold, maybe not the time to go to urgent care.